some of my cancer patients did better than others, despite having similar cancers and similar staging. I also saw patients who believed they would thrive despite the diagnosis, and they would survive. And thirdly, I also saw other patients which unfortunately became depressed, anxious, and never got back to their pre-breast cancer vitality. And sadly, these seem to succumb earlier than expected. So I knew there was more to the survival story than just genes. Apart from my patients' anecdotal cases, I also was aware of the most common breast cancer gene, BRCA. I was aware that not everyone who carried this gene ended up with breast cancer. In fact, 15 to 55% of patients carrying this gene didn't get breast cancer. However, in 2003, I did a fairly intensive course in nutritional and environmental medicine with Professor Melvin Sidney Smith. It was a eureka moment for me. The course was not exactly what I expected. In fact, it was so much better. For the first time, food was discussed in terms of the metabolic pathways they regulated. And the nutritional treatment for breast cancer was also discussed with evidence I couldn't refute. It has to be said, there is no miracle cure, but there certainly is good evidence that nutritional treatment can improve our survival and our ability to thrive. And as you'll see in the next slide, it is a perfect adjuvant to conventional treatment. So on this next slide, this is a picture of a breast cancer cell. As you can see highlighted in yellow, there are many pathways for breast cancer cells to grow. And this highlighted in yellow is also where plants, foods, and good nutrition have got evidence of working. So at present state of evidence, I recommend no soy unless you were brought up eating it, because it appears there are certain vulnerable times in breast development when soy can be protective. It can be protective as an embryo, during adolescence, and during pregnancy. But because, for all intents and purposes, we don't really know, unless we're Asian, what our estrogen receptors are like, it's probably safer to not have soy at all. Again, all fruits are good. Grapes and berries have the most evidence. Citrus fruits, pomegranate, and apples, especially the flesh of the pink apple, has benefits in upgrading apoptosis, killing cancer cells. The good thing about grapes is that they have a component called resveratrol, which actually helps improve sensitivity to tamoxifen, which is a common problem in a lot of cancers. So it's worth knowing that that can be helpful. And it also reduces metastases and spread.